Good morning, world. This is Sunday, and today we are here with yet another new video, which is it is going to be a special video, and it is about how to detect your बोन मैरो ग्रुप. लाइक जैसे हम लोगों का ब्लड ग्रुप होता है, सबका डिफरेंट होता है, A B O AB, पॉजिटिव नेगेटिव RH एंड ऑल दैट. वैसे ही वी हैव the bone marrow group of every person is different. So grouping of bone marrow is been done in only one institute in the whole world, which is situated in Germany. Okay, well, today I am here to recollect one video of Abhi and Neo also, from which I got this info and how to get this kit. This kit I'm talking about. This kit is, I'm going to open it right now because I have received it just now. This kit has got some special equipments which will tell what is my bone marrow group, and this data I'll be sending again back to Germany, and then they will have a database of bone marrow grouping. Why am I doing this? It is for the mankind, so that we can treat cancer patients. Like if you know the bone marrow group of any patient, so and you are the donor is the compatible bone marrow group, so he or she can donate the bone marrow extracts. Okay, and the patient can resurvive or can be saved. So this database is being collected by DKMS bmst. This is the company's name, and they are like doing it because there is no such grouping agencies in India who are collecting the database like we have for our blood groups and all that. वैसे ही, so these people have taken the initiative of doing this. So I have received it this morning. It is by my name, Dr. Sukirti, and it has come all the way from Germany. So this kit, I'm just opening it. Has got my info, everything. You can also be a donor. So they say that we delete blood cancer. Okay, so this is for blood cancer patients, and once you know your bone marrow grouping, they just keep the database collected, and if needed they ask you, would you like to donate your bone marrow extracts to the patient who is suffering from blood cancer or not. If you give your consent, yes. ऐसा नहीं है कि आपका पूरा बोन मैरो मतलब एपिड्यूरल लगा के सर्जिकली निकाल के एक्सट्रैक्ट्स निकाल के दे विल डोनेट. The system is, there is one injection in which your bone marrow cells will come to the peripheral tissues, and with that injection, when the bone marrow cells comes into your peripheral tissue, they just extract few of them and they infuse it to the blood cancer patients. So this is the kit. Remember, this kit is not the one which is the donor kit. This kit is the database collection by the Germany company who are keeping the data of bone marrow blood group. So I had gone through a video of Following Love and Abhi and Neo. From that I got this info that we can also give our contribution to the mankind for the blood cancer patients. And this is the kit in which I have received an envelope which says, as a huge letter by Patrick Paul, who is the CEO, and they write, Dear Dr. Sukirti, many thanks from DKMS BMST for taking the first step to be the potential blood cell donor. You just need to do one last thing before the registration process is complete. Swab your cheeks. We have to just swab our cheeks. I think there is a swabbing kit inside. So they have given another envelope which we have to send back to Germany. with the swab kit. This is the swab kit, and they say thank you, and this is the swab envelope. We don't have to tear it, we have to be very cautious. So they have given 3 swab sticks, cotton swab sticks. We have to just swab our cheeks, and we have to put it back here, and we have to send it back to Germany in this envelope. That is all it is. So no cut chat, kuch bhi nahi karna, no bloodshed, nothing doing. So it's a very safe procedure. In this way you can at least give one step to save the blood cancer patients round the globe. Okay, so this envelope I was reading about says, many thanks for taking the first step to be the potential blood cell donor. You just need to do one last thing before the registration process is complete: swab your cheeks. That is all. Enclosed you will find the following materials you need to complete your registration: consent form. There's a consent form, yeah, a form which needs to be signed and sent back to us. The donor copy is for you to keep for your records. Okay, this is the consent form. Okay, then second is swab, 3 swabs for collecting your cheek cells, cell tissues samples. Then number 3, buccal swab envelope. Buccal swab envelope is, you have to swab either here or here or here with that cotton swabs. So 3 swabs together, and to place your swabs inside the envelope and send it back to us. Then business reply envelope. This is the business reply envelope. We have to send it back to Germany. A prepaid envelope to insert the signed consent form, and swab envelope to be returned back to DKMS BMST. So the company who is keeping this database, who has taken the initiative globally to eradicate blood cancer, is DKMS-BMST, all caps. Okay, you can also search for them, and you will get an online link. And once you are registered, very simple questions they ask: your name and all, your address, everything. And then they, after few days or maybe a month, because there's a lot of like congestion in this, because there is only one agency around the globe who is taking care of this thing. So that is why there's a lot of congestion you can find, because India mein people are not that aware and they don't know this agency or institute. So that is why we are making aware, we are taking initiative to make people aware that there is such agency who are taking a database of your blood group, your bone marrow groups. Okay, so last is instruction sheet, a step-by-step guide to help you follow the process. Additionally, you can click on this link to see how exactly it is done. So they have given a link also, as you can see, it is dkms-bmst.org/HOWTOSWAB. It means how to swab. There's no space, mark my words. Okay, and your swab samples can be the only hope for survival of a patient, so returning them on time is very important. The sooner you send it back, the kit, the faster we can add your individual HLA profile. So they call it an HLA profile to the registry, making you available for the patient in critical need of a stem cell transplant or the bone marrow transplant. Okay, stem cell is the biological term, and bone marrow transplant, as we say, is a very common word which we all the civilians know. So that is why instead of stem cell I'm using the term bone marrow cell transplant or whatever. So if you still have any doubt or queries, contact us at donor@dkms-bmst.org or visit our website at dkms-bmst.org/FAQ, that is frequently asked questions. Thank you once again for joining our fight against blood cancer. Regards, Paul Patrick. Okay, so join us in the battle against blood cancer, join our community and be the superheroes. They have their Facebook, IG, Instagram, Twitter and LinkedIn link also at the footer of this envelope. And so this is the consent paper which they have sent it. It's a 2 sheet leaflet. One is a Xerox, which I have to keep it back as my copy, and one is their copy. And this is the sticker which I have to, there is a sticker behind which I have to stick, I guess. Yeah. So first name Dr. Sukirti, surname Biswas, my DOB, my gender, then my phone number, my personal alternate, then I have given my alternate mail ID as my husband's number, means mail, and his number also, so that he gives the alternate contact person. And please check the information above is correct. If it is not, please make any correction and then sign the original form and return it to us, keeping the copy for yourself with your signature. The document will be legally binding. Please note that age limits and exclusion criteria apply. These are listed on the reverse of your copy for this agreement. Please read carefully. I pledge to join DKMS BMST Foundation India database of potential blood cell donors. I have read the educational materials provided and had the opportunity to ask questions and received satisfactory answers. According to my knowledge, none of the exclusion criteria listed on the reverse side apply to me. I consent to my cheek buccal swab sample being collected, transferred, stored and tested for HLA typing and other laboratory tests necessary for apply to me donor and patient matching. I understand these tests may be carried out at identified or contracted laboratories in India or outside, and that my sample will be transported to these laboratories. I will not receive any monetary benefits. I will not receive any monetary benefits. I read it again for you. For registering as a donor, for being chosen as a possible match for the patient, and for a possible stem cell donation. I will not be charged for any future expenses or costs related to testing. I have provided DKMS BMST with my correct contact info like mobile number and ID and correct address, and I agree to update the same in case if any changes in my contact details or health status. DKMS-BMST shall maintain strict confidentiality and shall not disclose donor details such as mobile number or anything. I agree to be approached, contacted representative via contact details, blah blah blah. My registration is entirely voluntary. I have the right to unregister at any point of time in writing by informing DKMS BMST new Bengaluru .org. Okay, so this is all about the consent. So this one I have to sign, the copy I have to keep it back. Now there is a pictograph which has been given. So they say fill the consent form, take the cheek swab, then blood test, medical checkup, BBSP, and transplanted to patient. This is how they are doing it. So in case if it is needed, like the donor generally recovers from the peripheral stem cells collected within 1 or 2 days following the procedure. If any patient needs your stem cell, how do they execute? They fill out they give us a consent form. We again send a cheek swab, and once if it is registered, it is already there. Okay, then they ask for a blood group or blood cell or whatever blood test. Then they do our complete medical checkup. Then they do our PBSC, that is peripheral blood stem cell collection. Okay, they give one injection, and where from which the stem cells come to our peripheral cells. So they extract it from there only. They do it with the negative aspiration, and that is quite painless, completely painless. Okay, and then it is transplanted to the patient, and with such a small step, baby step, you can simply save many lives or one life minimum. Okay, so who is eligible to donate? So there are things like you need not, most important exclusion criteria, they say heart diseases, if you have a heart disease, lung disease, then severe kidney disorder, thrombosis, cancer, HIV, AIDS, you can't do in such cases. Okay, then autoimmune disorders, metabolic diseases like diabetes, so diabetes patients also, they generally like exclude, so that there should not be any confusion or something later on. Okay, belong to, or obesity, somebody who is whose basal metabolic index is more than 40, or BMI is equal to weight by height raised to 2 is quite high, so they exclude those patients. Okay, and of course cancer patients are also excluded, they can't be the donor. Okay, so peripheral blood stem cell collection, that is PBSC, is a safe and most commonly used donation method today. Prior to the blood stem cell collection, the donor receives a daily injection. The donor receives a daily injection and daily injection of GCSF for 5 consecutive days. This injection makes sure that your stem cells comes to the periphery. Okay, so for 5 consecutive days, to mobilize and build up the number of injections, the donor may feel flu-like symptoms sometimes, but these will disappear after the donation. Donation के बाद these symptoms goes away. Flu like means you can feel some kind of mucus thing or something like that, सर्दी जैसा and all that. And there are no known long-term side effects for this injection. One day of donation, the donor blood is collected from one arm using a sterile disposable kit and passed through a machine that separates out the increased number of blood stem cells. The remaining blood is routed back to the donor through the arm only. So they extract the stem cell and they infuse the blood back to the patient. They can do this. They have this technology. Okay, this is very safe, non-surgical outpatient procedure, and that makes approximately 4 hours to complete. That is all. Okay, recovery period, the donor generally recovers from the peripheral stem cell collection within 1 or 2 days following the procedure. That is all it is. Vital stem cells are present in abundance in the bone marrow of the iliac crest, that is hip bone, and not to be confused with spinal cord. If a medical exam determines donor is suitable, there are 2 ways in which stem cells can be collected. One is stem cell donation, blood stem cell donation, which is complicated. Collected method, the donated stem cell will naturally replenish in 1 or 2 days. Okay, the characteristic, you will be asked for blood samples. If result confirm you are a suitable donor, they will ask you. So that's a complicated one. But this PBSC, that is peripheral blood stem cell collection, is a very easy step and can be done very hassle freely. So this is how they do it. Okay, so I have read this. Now again there is a pictographic envelope. So they say how to swab your cheeks step by step. Please make sure that you do not have any bits of food left in your mouth before using the buccal swabs. You should not be eating anything or chewing anything. You just have to clean your mouth very nicely. Carefully open the package and remove one of the swabs from the package. Do not touch the swab head with your fingers or anything else. Picture number 1, picture number 2, then picture number 3, 4, 5. They say first swab, rub the swab in a circular motion for 1 minute across and inside one of the cheek for 1 minute. Then second swab, repeat it with second swab across the inside of the other cheek for 1 minute. Third swab, repeat of the third swab across the inside of your upper lip, like here and here, along with swabbing left and right cheeks for 1 minute. Okay, so you have to rub very thoroughly. The package used previously for the swabs is no longer required and can be discarded. The packet in which it has come can be discarded. Now hold the swab. This packet, they are saying the packet, this polythene packet, you have to just throw it. You don't have to keep it back there. Then hold the swab for 2 minutes until it gets dried. We have to dry the swab what has come out for 2 minutes. Alternatively, you can place them in an empty glass of swab heads pointing up. Make sure that the swab heads do not touch each other. The swab heads should not touch each other. So to make them dry for 2 minutes, that's all. Then place these dry swabs in the swab envelope. We have to simply put these into this hard envelope. There's a bag like structure here, and that is all. Then send it back. Sign the consent, place on barcode sticker and on the upper corner of the swab envelope and containing 3 swabs, and now post it at no cost by dropping it off at any nearest post box, or call us at 08068286588 Monday to Friday 10 a.m. to 5 p.m. to schedule a reverse pickup, which is subjected to serviceability by the courier partner. That's all. We can give a missed call or a call. So from Monday to Friday they come 10 to 5 के बीच में they come and they collect your swab, the courier partners, the logistic partners, and they send it back to Germany. Another is you can simply put this one into any post office box, which is even easier. So up to you, whatever means you want to go for. So that is all about it. So I'm going to open it, I'm going to tear it, I'm going to send it to Germany. 1 life minimum can be saved. Thank you so much for watching this very valuable video. And again, if you get any value from this video of health and blood cancer safety, then please write, subscribe, hit the bell icon and comment, share this video as much as you can so that we can share the awareness for blood cancer safety. Thank you so much for watching me. Bye bye. This is Dr. Sukirti signing off from Kolkata, India. Bye.